Hi, Doc Barry here again. Okay, so I've been on Facebook for 20 years or so, and as those of you who know me are aware, I've never really used it as a platform to post videos or anything to do with marketing. Facebook for me has been just a extension of my ability to communicate on a personal level with people. I don't use it for business or any type of dating platform or forum. For my professional interaction, I have a huge LinkedIn network that I primarily use. And as a matter of fact, for the recent video I posted on the Cold Arrest Hypothermia Therapy, which has had such a phenomenal response that quite frankly surprised me. That's the first video I've ever posted, but I felt it was relevant and would hopefully provide some useful information in light of the recent health concerns regarding the coronavirus epidemic or pandemic around the world. So due to the response to that video and a request for further detailed information regarding the 3-step protocol for the Cold Arrest Hypothermia Therapy, I've decided to post this follow-up video, which again, I hope will provide some useful information to anyone wanting the straight, honest account of what I believe we should all know. This video will probably be a bit longer than the first, but I will try to limit it to a summary of what actually happens when a person gets infected with the SARS-CoV-2 virus, so that you'll know what to expect and be prepared to identify an infection without any fear or speculation on the stories you may have heard on the news. And then I'll describe the simple 3-step hypothermia protocol in detail. But before I get into that, for those who are not familiar with me, I will very, very briefly recap my background. Those of you who've known me over the years are probably aware that my formal medical training focused on the specialty of cervicomedullary gliomas, or brainstem tumors, which only occur in children under 10 years of age. Then, when my mother was diagnosed with terminal stage 4 brain cancer, my focus turned to oncological research, which led to the development of my HSRP protocol for cancer patients, and is centered around anselm, GC-MAF supplementation, and triatomic oxygen hypothermia therapy. I gave an oral presentation on this subject at a medical conference in Zurich for the International Conference on Biomedical Sciences and Oncology in January of 2016. And there's a short video that I may post. It's already on my Facebook, but of the review on the World News Tonight, the European edition. I never did the marriage thing or the family thing, not because I didn't want to. I was working and studying so much that came close twice. But in any event, I spent the majority of my life, since I didn't have a wife and kids, to make demands on my time, studying and earning various degrees, both inside and outside the field of medicine and healthcare, at various academic institutions throughout the world. Harvard Medical School, Oxford, UCLA, Stanford, Beijing University of Traditional Chinese Medicine, Hainan University, and other institutions. But some relatively unknown schools as well, such as Eisenhower University and even Roxborough Technical Institute. So I went back to school at California State University in Los Angeles to obtain a double major degree in computer science and biology after I realized the future need for that field when the Human Genome Project began back in 1990. I saw that in medicine, computer science and computer information systems was going to be vital in the future. Back then, they didn't even have a curriculum for it yet, and the new field was known as computational biology or proteomics. So it's been an interesting career, to say the least. But now, on to more important things. Okay, so if you're watching the news and all that, you still don't really have any clue as to what actually happens when you get infected with the coronavirus, because everything you hear is saturated with fear. And that's because sensationalism is what sells ad space on TV. even on the news channels. So I'm going to talk to you like you were sitting right here in my living room with me, with no bullshit, or at one of our 26 medical facilities in Los Angeles, at the Mission City Community Network. You can check us out online at mccn.org. There's my shameless plug. So here's what happens if you get infected with the coronavirus. If you're lucky enough to be in that category of patients who aren't that sick, or if you're in the category of patients who get really sick. So the first category, the patients who don't get that sick, they may have a fever, they may have a cough, and it's often a dry cough, but in some cases there can be the production of phlegm, mucus, and snot. And then some people have mild presentations of shortness of breath in the beginning of the infection. But many patients don't experience this. So it actually feels just like the flu or a cold, and you can experience muscle aches, fatigue, and that sort of thing. Now, the majority of patients in the series that we've looked at recover within about 2 weeks, 14 days. The symptoms dissipate, or maybe they barely have any symptoms at all. However, when we scan for the lung condition of these patients, it reveals lung pathology or abnormalities that they're not feeling any symptoms for. So we even looked at the cruise ships and found that the people that were being tested were returning positive results that didn't present with a lot of symptoms. So that's undoubtedly how this thing is spreading. People are infected and they don't even know it. Okay, one thing you guys should be aware of is, if you go to the gas pumps to get gas, if you have to be out and go places, that gas pump people are touching. Wear gloves. Put prophylactic gloves on so that you don't touch it, and take them off and throw them away before you get back in the car. Because if you get back in the car and you're still wearing the gloves, you can put it on your steering wheel, and then if you forget, so wear gloves, throw them away after you pump the gas. People are infected, they don't even know it, and at present, we simply don't have the capacity to test everybody. We're working on it, but we don't have it at present. So mild symptoms, not much cause for alarm or to alert us to impending danger. Now, what is different in the patients who get severely sick? Well, and these tend to be primarily older people and people with underlying health conditions. And that means they have either a lung disease or diabetes, high blood pressure, heart disease, or they are immune compromised. But we're not seeing the majority of people hospitalized now that are in the older categories. The majority of people that are hospitalized now are between the ages of 20 and 54. So it's not always the case, but it seems that the older patients are hit much harder by this disease, and young kids are particularly spared by it. So in those older patients, what may happen is sometime after the initial symptoms manifest, maybe even a week or 10 days on average, you suddenly take a turn for the worse. And the way this occurs, or that you can notice it, is with shortness of breath, a lot more than you've had previously, noticeably. And some people really feel just like, damn, I'm really having a hard time breathing. And this is often what causes them to go to the hospital and seek medical help. So they end up in the hospital, and from that point on, it becomes a rapid decompensation. This means that if you do the scan of their lungs then, after they're in the hospital, the lungs show these very distinctive patterns of pneumonia. It's often on both sides of the lungs, often in the periphery, the outside part of the lungs, and it usually leads to about 15% or higher of the patients having to be placed in intensive care unit, ICU. Now, at that point, they need help with continuing to breathe, whether it's with the assistance of a high-pressure mask, a lot of oxygen, or being intubated, having a breathing tube inserted down their throat, into their trachea, and into the lungs. Now, why does this occur? Well, the reason is pneumonia, which is a type of inflammation caused by the infection and the immune response to the infection of the lungs, causes a barrier to form between the ability of the patient to exchange oxygen and carbon dioxide with the blood in the air. As a result, you feel like you can't breathe. The oxygen level in your blood drops. You may have a white blood cell count that's either too high or too low, and your liver function tests will be slightly abnormal. So those are some of the lab tests that you see. But most notably, you just see that they're having trouble breathing, oxygenating and exchanging gas. So at this point, you might have to put in a ventilatory assistance tube, which is known as an endotracheal tube. And then what we see is, in the patients who get really sick, they develop something called acute respiratory distress syndrome, ARDS, ARDS. And this is why this disease can be so fatal in people who it does affect that way, which again are a minority of the patients that are infected. So all the sensationalism, the fear-mongering, the outright bullshit you hear on the news, and keeping in mind that this can happen with influenza, and it does happen with influenza. So when they get acute respiratory distress syndrome, this is when the lungs really take a hit. The actual cellular structures of the lungs gets damaged or destroyed. When biopsies are taken of these patients, you see the little alveoli sacs where the inhaled oxygen in the air is actually exchanged for carbon dioxide and toxins that are exhaled. They're severely clogged up, damaged, or destroyed. In these situations, it takes a lot of assistance to ventilate those patients and keep them breathing. It's often associated with other problems resulting from the immune reaction to the virus. This includes sepsis, which is sometimes due to a secondary infection. And that occurs because your lungs are all gummed up and you're on a ventilator, and this creates a moist environment. And that's an ideal condition for bacteria, viruses, and other pathogens to thrive. You can often get a second infection like pneumonia, and those are the kinds of things that can cause everything to get much worse. So at that point, if you have sepsis, you can suffer multi-organ failure. Your blood pressure can drop to fatal levels. You can go into shock and die. You can have trouble ventilating. You may require the assistance of dialysis for your kidneys to keep functioning. Or ECMO, which is an external oxygenation device, kind of like a bypass machine. And when it gets that serious, your chances of dying, quite frankly, are extremely high. In medical terms, in theater during surgery, we refer to it as the patient is CTD, or circling the drain. If you actually survive that, your chances of having some type of permanent disability in your lungs due to the scarring or other responses from the inflammation are almost guaranteed. And this happens with SARS as well. So we're seeing this pattern with this strain of coronavirus. So this is how people tend to get sick. The bottom line is, if you're having mild symptoms, fever, cough, and you're not having a lot of shortness of breath, you probably don't need to go to your doctor or show up at the hospital. You can call any medical facility, or you can call us, and we can talk about that in a separate video. But for the people who get very sick, the 6 warning signs are: 1, a real shortness of breath, dizziness, lightheadedness, changes in your mental status, your ability to think, and the inability to keep food down. Those are the 6 signs you really need to be aware of and seek emergency care for. So I hope this information was helpful. Those of you who have remained with me all the way through are now more knowledgeable than 95% of the population out there regarding this coronavirus pandemic. Now, regarding the 3-step protocol for the hypothermia therapy, for those of you who requested further details, here it is. Keep in mind that this protocol has been successfully tested and used in more than 55 countries with extremely high success rates. Here's what to do. Step 1, get a hairdryer. Turn the hairdryer to the lowest setting and then cup the fingers around the back where the air is sucked in the opposite end from where it's blown out. Put it on automatic blow at the setting you want and put your fingers over the back. And this will slow the airflow and increase its output temperature. That's step one. Step two, with the other hand, get the hairdryer in one hand, with the other hand, get a spray bottle filled with water to frequently moisten the facial surface around the nose and the mouth. The flow of the hot air causes the water to evaporate, keeping the face and the nose cool while allowing the heat to penetrate deeply into the nose and sinuses. Take slow, deep breaths through the nose with the mouth closed for 5 minutes. To minimize any discomfort, turn the blow dryer aside in between breaths. So you're blowing the blow dryer into the nose, breathing in. Put the blow dryer back, breathe in again. The goal here is to raise the inside of the nose and the sinuses to the coronavirus kill temperature of 56 degrees centigrade or 133 degrees Fahrenheit during the entire treatment period. So use the highest temperature setting that you can safely tolerate. And step three, after a 5-minute treatment, pause for 1 hour and then begin another 5-minute hot air treatment. If no symptoms have appeared, 2 heating cycles per day should be sufficient for prevention. But if symptoms have already developed, then 5 of these heating cycles alternating with the 1 hour of cooling in between per day are recommended until the symptoms disappear. Now, it's my belief, based upon the literature and previous studies, that if widely used, this simple cold arrest hypothermia therapy, combined with the washing of hands, the face, the social distancing, can help to halt the further spread of COVID-19. It also kills most other types of common cold-causing viruses. So you can start using it at the very first sign of any common cold symptoms. If healthcare providers will teach patients the cold arrest protocol, and health authorities will distribute inexpensive blow dryers and spray bottles to those that are in quarantine or living within the infection zones who don't already have them. Of course, the use of 15-minute sessions in a sauna at 135 to 140 degrees Fahrenheit would be optimal. But for those that don't, this protocol works. And we may be able to prevent future coronavirus outbreaks from ever again becoming regional or international pandemics. Now, I'm not posting these videos or doing any of this for money or anything like that, but if you found this information informative or of any value in diminishing the fear and unknown factors of what to look for, I would appreciate your liking this video. And if you want, giving me any feedback you feel is relevant. Remember, we're all in this together. I'm Doc Barry, and I hope you all stay safe and healthy.